everybody. Welcome back to Rural Health for You and Everybody. I'm Amber Sorenson, the marketing director at the Murray County Medical Center. This podcast episode is going to follow a bit different of a format than previous podcast episodes. June is National Scoliosis Awareness Month, a topic that I have personal experience with, given that I had a spinal fusion surgery in 2011, the summer before my 8th grade year of school. So in the episode, I'm going to be talking with Tom Bergman, one of our rural health clinic providers, about some of the basics regarding scoliosis, given that a lot of the general public doesn't necessarily know a lot about it in depth, but I wanted to provide kind of a preface to our discussion here first. So, as I mentioned, June is National Scoliosis Awareness Month. I was diagnosed with adolescent idiopathic scoliosis in early December of 2009 when I was 12 years old. So pretty early on, kind of that pre-puberty age. So basically idiopathic just means that there's no specific cause for why it occurred. Just for the definition's sake. And as I'll mention later on in my discussion with Tom, at that point, my curve of the spine was about 32 degrees, which isn't really quote-unquote bad, but it's not super great either. So for about the next year and a half, I returned to the specialist that I was seeing for follow-up appointments to monitor that progression of the spinal curve, and it progressed pretty rapidly from about 32 degrees in 2009 to 52 degrees in about mid-2010 to almost 60 degrees in mid-2011. So there are a few different treatment options for scoliosis. If caught early enough, some people can be successful with bracing techniques, which a specialist would be able to discuss more with you if your child has scoliosis. But if it does follow that kind of rapid progression, another option that is often gone with is the spinal fusion surgery, which I ended up having. This spinal fusion surgery, generally, at least mine did, involves placing 2 titanium rods into your spine not into your spine, but into your back to kind of straighten it with a multitude of screws. And generally, as Tom will talk about later on in the episode, this is a very major operation. Physically, as a child, as a 12, 13-year-old, it remains to this day probably about the worst physical pain that I've ever experienced. But the surgery is often a good route if your curve gets to that almost 60 degree and possibly even further range. So like I said, there's bracing, spinal fusion. Honestly, some people will just watch and wait kind of thing. If your curve isn't super high, if you're at a lower than 30, 20, somewhere around there, watching and waiting is an option. You'll just have to talk to your specialist and see what they recommend. But as Tom will discuss later on in the episode, just from the standpoint of a primary care provider, those early interventions are super key. It's not necessarily going to change the direction of whatever way your spine ends up curving. You might still end up needing surgery. Bracing might be successful. There's really no way to tell, and it kind of varies from individual to individual. But getting in for those yearly checks, especially if you don't have a family history of scoliosis, is really key, just because it's not necessarily something that a lot of people know about, like I mentioned earlier. I do have a sister that had scoliosis, and she had surgery a few years before I was diagnosed, I want to say. So my parents were kind of aware of it in that regard. But who's to say if it was caught earlier, if the outcome would have been different? I don't know. There's really no way to say. But yeah, like I said, especially if you don't have that history, if you don't have that pre-existing knowledge of the condition, it's really, really important to get in for those well-child visits. Scoliosis is more often seen in females. I really don't know why, as the marketing director of MCMC, but it is generally seen more in females than males. Not to say it can't happen in males, just more often in females. And like I said, kind of around that pre-puberty age, 10, 11, 12, 13, kind of around that age. So MCMC can help with those yearly checkups in particular, and given that we are obviously in the summer months now, getting your child in for those checkups is really crucial. While we're out of school, out of the normal school year activities, our clinic providers have the time to get your child in to do all of those yearly screenings, including for scoliosis, and make sure nothing's amiss. And that's really key, just to stay on top of this condition, if your child happens to be diagnosed with it. And as Tom says later on in the episode, it's very key to be more proactive than reactive when it comes to this condition. So I think that's about all I have, but without further ado, we'll get into our conversation with Tom Bergman. Hello and welcome back to Rural Health for You and Everybody. I'm Amber Sorenson, the marketing director at the Murray County Medical Center, and I'm here with Tom Bergman, who at this point is our most frequent podcast guest. Hello, Tom. How are you?
I am excellent.
So for those of you that don't know, Tom is one of our rural health clinic providers here at MCMC. He is from Fulda, and in another life, he was a physical therapist and was at Mayo for a little bit, and then came back here and does family medicine, orthopedic stuff. Anything else you want to add, Tom?
No, that sums it up pretty good.
Perfect. So, as you know, June is National Scoliosis Awareness Month, which is a cause near and dear to my heart, and that's what we're going to be talking about today, because although a lot of people don't actually know what scoliosis is, it's actually one of the most common spinal abnormalities that's generally seen and kind of interventions taken in children and adolescents. So, would you like to give the medical-y definition of what scoliosis is before I give more of the personal side of it?
Yeah, so scoliosis is just a abnormal curvature of the spine somewhere. It's usually kind of snakes itself along the whole spine. When you evaluate for it, you typically look at an x-ray the lumbar region and take measurements of the curve and kind of assess severity that way. There's different kinds of spinal curvatures like lordosis, kyphosis, different kinds of osises that aren't scoliosis. So if you are evaluated, we all know how to discern the differences between those. And I guess my main plug here is, having especially children coming in for their yearly evaluations is pretty important, because if they have something like this, you want to try to be proactive as best as possible and address the things that need to be addressed. And sometimes I can think of one example of something that kind of makes scoliosis apparent is leg length discrepancy. So it's nice just to know different things that kind of reveal or mask the problem, and that's just one. But anyhow, I guess my point is it's important to not miss your yearly checks.
Yes, indeed. So this podcast episode is a bit different because I have personal experience with our topic of the day, which I usually don't. I think there may have been a few times. But in my case, I think I was probably about 12, 11, somewhere around there, when I was actually officially diagnosed, and the telltale sign, besides my sister also having it, were that my shoulders were uneven.
There you go, that's another one.
Yes, so my shoulders were uneven, and I think that one of the first kind of steps that my parents took was kind of maybe not so much getting in that primary care visit, more so a specialist, just because there was that family history. But care to speak at all on the potential family history aspect of it, if you know anything regarding that?
Well, statistically, I guess I can't give out any numbers, but like any condition, there's a genetic component to it for sure. And if you have a first generation family member, really with anything, but with scoliosis, certainly you got to be well aware of it and keep an eye out for it.
For sure. So when I was first diagnosed, I think my curve, they said, was around 30-some degrees-ish, which isn't bad, isn't great. A lot of people will say that they have a very, very slight form of scoliosis, but it's not necessarily enough to require surgery, is what I found out after my surgery and all of that business. But then it kind of rapidly progressed over the next year and a half to close to 60 degrees by the time I actually had spinal fusion surgery. So, got any numbers to throw around as far as bracing versus surgery versus just watching and seeing progression?
Yeah, so if a person fails the eyeball test, you kind of graduate to getting x-rays, and then there's a certain angle that you can measure, and that'll kind of tell you, are you in the territory of watchful waiting, bracing, or surgery, based on those numbers. And pretty much what would happen here, if you would be seen and there was any sort of decision to be made, we would refer to a specialist who deals with this kind of thing. We're not going to, make huge decisions like that, because we just don't see enough of it to really know what is best. I mean, we can follow the book answer and things, but I think all of us would still recommend a referral to a specialist, someone that sees this stuff all the time.
And would that likely be in Sioux Falls, somewhere else?
Yeah, probably Sioux Falls, maybe Rochester. Kind of depends on, where the family wants to go and if they do any research and I guess have any preference. I mean, we certainly work with the parents and the patients and, ease that transition.
For sure. Now, let's see. Gonna get into a bit of the personal side because you're a parent and I am not. So, I guess kind of say somebody had a 10, 11-year-old kid, somewhere around there is frequently, I think, when scoliosis is kind of first seen. As a parent, as a medical professional, if the shoulders were uneven, if the legs were uneven, if there were some other signs, I guess at what point, either personally or professionally, would you be worried enough to bring your child into MCMC, for example?
I think if it's noticeable at all, it should have a professional look at it. Like I said, there's a handful of things that can, make it seem like there's a portion of scoliosis, but there might not be. And if, as a parent, if you're not experienced in figuring that out, well, you need to find someone that is. And, a lot of times it's kind of going to progress. If it ends up being scoliosis, it's going to progress at least somewhat. So, I think being proactive is very important. And there's some physical therapy type things that can be of some assistance for sure, that even if it's a very tiny amount, it's still important to at least introduce the first steps. And then at which point you can continue to monitor at a certain interval, whether that's a few months or a year at a time, and just kind of see how it goes. And I would think by the time a child is finished growing, that's when you're going to see most of your change, and after which there probably isn't going to be as much change. And in your case, you said that you had surgery, correct?
Yep.
And you were 11, 12, something like that?
When I had the spinal fusion, I was 13
Yeah.
at that point. Yep.
So surgeries are extensive, and when you have a spinal fusion, usually they do large segments. It's not just one or two that you hear about when people have it for like disc disease, for instance. They can go the entire lumbar, thoracic, spine essentially, and that's a major operation, and it's not what you really want to have. So, it's important to find this as soon as possible, I guess is my point.
100%, and I agree that surgery is awful. Not awful, but as a kid, it's kind of awful.
Sure.
It's very painful, so I would definitely err on the side of being proactive. I think kind of something that I wanted to get a bit into and see if you had any thoughts on were that a lot of people, I think, you mentioned that we don't see a lot of scoliosis spine stuff here amongst kids. I think a lot of people, like I was mentioning earlier, aren't as familiar with scoliosis. I mean, I really didn't know anybody with it except my sister kind of being diagnosed with it and whatnot. So dealing with the aspects of surgery and even the prior components were very difficult just from a psychological stance. Would you have any recommendations on that for people's kids that might be going through some issues in kind of that pre-puberty age where emotions and whatnot are raging?
Well, yeah, I mean, in that situation, you kind of got to do what you got to do. And as far as mental health, I mean, yeah, that's something that's very common amongst kids. And just like in any other situation, there's medications, there's therapy, and neither of them are better than the other necessarily, but both in conjunction are better than either one alone, I guess is what I'm saying. But yeah, there's ways that we can be of assistance if that's the case.
For sure. And I think that's probably about all that I had, unless you had anything to add.
Not really. I think we kind of covered enough, but I guess to sum up, try to get your kids in for their yearly checks. It's a very easy thing to do, and you don't want to be missing something this important.
For sure. And to schedule those yearly checks with Tom or any other rural health clinic provider, you can call the clinic at 507-836-6153. That's 507-836-6153.